Hi, this is Imani Mays. This is a genetics presentation on Fragile X syndrome. Fragile X syndrome is a genetic disorder caused by a mutation in human deoxyribonucleic acid, more commonly known as DNA. The pathophysiology of the disorder involves a mutation of a gene on the X chromosome called Fragile X messenger ribonucleic acid 1 or FMR1 gene. The mutation is exhibited by too many repeats in the DNA nucleotide sequence, which does not allow space for FMR1 to do its job. FMR1's job is to transport mRNA within cells, helping cells make their proteins. The mutation leads to a dysfunction in cell protein function, and this is primarily in the brain, potentially leading to intellectual disability and autism spectrum disorder. These are responsible for many of the varying manifestations of Fragile X syndrome. Fragile X syndrome is unique in that it affects males more commonly and usually more severely than females. The reason for this is that male DNA is composed of one X chromosome, negatively affected by the disorder by default, while that of females has two X chromosomes, so they may be considered to have a quote backup end quote chromosome for proper functioning. It is also unique because affected individuals can have pre-mutated or fully mutated genes. Pre-mutation is associated with a carrier state and with little to no symptomatology, usually. Full mutation is associated with full symptomatology of Fragile X syndrome. This gene mutation disorder can also cause Fragile X associated primary ovarian insufficiency, which causes infertility, irregular or missed menstrual cycles, and or early menopause. It can cause Fragile X associated tremor or ataxia syndrome. This is an adult onset neurodegenerative disorder, and it is most common in males over 50 years old. Fragile X syndrome is an X-linked dominant inherited disorder. This means that it is a variation of a gene on the X sex chromosome, and that just a single copy of its mutation in the cell's chromosomes will cause the disorder. Sex-linked gene disorders affect males and females differently due to the genetic differences in sexes. Fathers will pass on the premutation or mutation to all daughters. A mother with a premutation or mutation on one of her X's has a 50% chance of passing it on to either her sons or her daughters. The genetic risk for Fragile X syndrome is based on a couple of factors. The number of DNA repeats of the nucleotides, or the CGG repeats, on DNA, and being born to a parent with a history of the causal gene mutation, as expected with any inherited disorder, is a risk factor. People with different numbers of CGG repeats have different risks of developing Fragile X associated disorders and of having children with Fragile X syndrome. The normal CGG nucleotide segment repeats 5 to 40 times. Individuals with more than 200 repeats have the Fragile X full mutation. Thus, they're at risk for severe symptoms. Having any number of repeats between 55 and 200 is considered a premutation and is a risk for variations in symptomatology. There are no environmental risk factors that were prominent in the literature associated with Fragile X syndrome. So when a patient presents with possible Fragile X syndrome, there will be a specific clinical history. One or several of these may be present, and it's usually reported by the caregiver because it's usually a child or somebody who has some sort of delays and cannot necessarily report it themselves. So the affected individual may have a caregiver who reports history of developmental delays, learning difficulties or disabilities, anxiety, aggression, ADD or ADHD, autistic behaviors, which, as we may remember, can be impulsive behaviors, delayed language development, poor eye contact, repetitive or delayed motor activity, social dysfunction, and unusual emotional reactions, to name a few. They may also report musculoskeletal problems, feeding and sleeping difficulties, and recurring vague HEENT infections and or seizures. Most of these can arise early in childhood, as early as 4 years old for some. There's also a very unique physical presentation for patients with Fragile X syndrome. On exam, they may exhibit a long face shape, widened forehead, larger ears, flat feet, also called pes planus, protruding chest, also called pectus excavatum, larger testicles or macroorchidism, hyperflexible joints due to connective tissue abnormalities. And we also want to note that it's important that just the history and physical alone are not the only two considerations for diagnosis, because this isn't clinically diagnosed. So that brings us to our next point: the diagnostics and lab findings for Fragile X syndrome. The FMR1 gene test is a polymerase chain reaction, or PCR, test used to diagnose Fragile X syndrome. This test uses a blood sample or a chorionic villus sample from a fetus and detects the number of repeated CGG mutations in the FMR1 gene. If a full mutation is diagnosed, a follow-up Southern blot analysis may be performed, and this is to confirm whether the gene is methylated. Methylation is a chemical change that inhibits normal protein synthesis by FMR1, and this can help differentiate premutation or full mutation when there's an ambiguously abnormal result. Red flags that can trigger additional genetic testing would be any of the history and physical findings, family history, fetal risk for inheritance of the disorder, and if the FMR1 gene test comes back abnormal, but it's ambiguous, there may need to be further testing. So when this workup is done for Fragile X syndrome, the lab will typically report the number of CGG repeats within the FMR1 gene. So positive findings for a pre-mutation state may be 55 to 200 CGG repeats, whereas a full mutation positive finding will be greater than 200 repeats. Methylation status can either be reported as completely methylated or partially methylated. There are a couple of sources for clinical guidelines and recommendations for patients with Fragile X syndrome. The first that I want to discuss is from the American Academy of Pediatrics, and this is called the Health Supervision for Children with Fragile X Syndrome guidelines. Now, these were published in 2011, which was a little while ago, and I do not see any updates, but the guidelines are very good. And hopefully they do have an update somewhere out there or on the way. I just haven't found it yet, but it does provide the exam guidelines for the provider, what we want to be looking for, anticipatory guidance for the provider and for the parent, and to give the parent the anticipatory guidance. And it does it by age group, so from birth to 1 month and from 1 month to 1 year. from 1 to 5 years, and so on and so forth. And it's kind of set up the way the pediatrics textbook is set up, and it gives some nice recommendations for monitoring children with this diagnosis. The next set of guidelines is from the National Fragile X Foundation, and they're called Transition to Adult Services for Individuals with Fragile X Syndrome. So these were published in 2021, so they're relatively newer, and these go through discussing services in the community, and it's all about the transition for this person with this diagnosis, the transition from adolescence to adulthood. So it gives a good, thorough description of the services in the community and how to access things like Medicaid waivers and supplemental security, how to get the DMV identification and transportation for these people, living options for them, especially after they finish school, because again, they're transitioning to adulthood. And it just goes through, um, things that can make these people's lives easier and as normal as possible as they transition from being a child to being living as an adult with this disorder. So those are a very good set of guidelines. Finally, we do have some resources for family education that can be directly accessed and understood by laypersons who are affected by this disorder in some way. So we have the National Human Genome Research Institute that provides a good webpage that is in understandable terms about Fragile X syndrome. And then Medline Plus is a really good medical encyclopedia that is easily read and easily understood. And the CDC also has a page that describes what is Fragile X syndrome. And the Children's Hospital of Pittsburgh has a good page that not only talks about Fragile X syndrome itself, but goes kind of in depth in an understandable way about the testing and who should be tested, um, and when, and it even has some documents that can explain the cost of testing and why someone would need a test for Fragile X syndrome, and etc. So again, these are some good family education resources. Please see my references, and this does conclude my presentation on Fragile X syndrome. Thank you.